Why is your testosterone lower than your father's was at the same age? And who can you actually trust to help fix it? If you want real answers to those questions instead of quick fixes and spotty information, you're in the right place.
If somebody is marketing testosterone as a product rather than actually the condition that they're trying to treat, I would take a second look.
I couldn't move in the ways that helps me fight my depression, and it terrified me at the time.
Your health is what's going to empower you. Nobody owes you anything except yourself.
My name's Tim Winnicky, and in our 28th episode of American Masculinity, we're bringing on Dr. Hisham Valiuddin. He's a ER doctor who's seeing these problems so often that he's starting a secondary practice to help men with them. He's here to help us get real information on what's actually happening within the science of these things, what we know and what we don't, and how to get competent care to help you should you have a problem. While you listen to the episode, think about the ways you've been addressing your hormone health and where you got the information from. We'll talk about it more at the end. Thanks for coming on, man. I'm really excited to have the conversation with you.
Yeah, happy to be here. And important subject, deserves attention, and love to talk about it.
Yeah, it's been really interesting just in my practice around testosterone and what's been coming up. So I think this is a pretty broad issue, and I think there's a lot of bad actors taking advantage of guys' fears. And so I'm really glad there's guys like you in the space to give some clarity to this.
Oh, absolutely. It's at epidemic levels, and testosterone levels have been lower than ever in the history of testosterone level testing. It's a very important subject, and glad that there are clinicians that are starting to pick up on it, diagnosing it, and then starting to treat it.
Well, so how does a guy go, like you're an ER doc, right? You're already helping people. I imagine that's some kind of fulfilling, helping people on the worst day of their life. How do you go from that to engaging in hormone medicine?
So we do personalized concierge care. And so I'm a lifestyle physician. And yes, so working in the ER, definitely a satisfying experience, fulfilling my life ambitions and passions of helping people on the worst day, and being at our best when they're at the most vulnerable. And practicing over years, I saw firsthand how many men let their health fall apart even before coming into the emergency department. Usually when you have an emergency, it's been building up for years. It's people with chronic conditions that leave their bodies at risk for what's going to eventually happen. And so we stabilize in the emergency department, but we can't undo the damage that's been already done over the past decade. Concrete examples of that, one of the most number one causes of mortality in the United States is acute coronary syndrome, myocardial infarction, heart attack in layman's terms. And heart attacks happen from cardiovascular disease. And cardiovascular disease is built up clogs in your coronary arteries, which is the piping system of your heart, the smallest vasculature, which has been building up for years. And so getting ahead of it, launched 40 Health because I believe that men deserve proactive, personalized, stigma-free care. And we're starting to get more and more information out there about what testosterone can do and what's the impacts it has on the various aspects of one's life. And personally, I'm of the age demographic where it starts to affect people. So I started looking into it for my personal health, started talking to my friends and colleagues about it. And I realized what a big problem this is in the community and at large. And so that's what inspired me to start to take this as a more of my time in my day and starting to guide my passions towards saving lives in a more proactive approach.
Yeah, my experience of it is both very personal and from my clinical area, right? So many guys are struggling with their health over the long term, and it usually comes from that idea that men, we shouldn't value ourselves, right? That it's unmanly to get ahead, to go to the doctor's appointment, to worry about your health, to get it seen to. You should just be able to put your head down and push. And I wasn't any different until in my mid 30s after grad school. Depression's kind of been a struggle I've had most of my life. And because of that, I know what to do with it, right? I'm an effective adult, I'm a clinician. I figured out the ways that I need to hold that are going to make me effective in my life. And all of a sudden, all the things I knew that should work weren't. I couldn't get the energy to exercise. I couldn't get the energy to cook right. I couldn't move in the ways that helps me fight my depression. And it terrified me at the time. And so I went in to get some mental health medication to try to take some of the edge off of this, to get my hands back under it. And luckily, the nurse practitioner also worked and moonlighted in a hormone clinic and was like, have you had your testosterone tested? And that's when I found out that I had the average testosterone at 38 as a 72-year-old of the 80s. So that was great, and kind of hit my masculinity pretty close to home, right? Feels like you're less than for a minute. And getting on testosterone absolutely turned all that around. It all the things that I know work started working again. But there were also some real health issues that either people didn't tell me about, or I was so worried about what was happening that I didn't pay attention to. And so later on, when me and my now ex-wife tried to have kids, I was unable to conceive. And I'm pretty sure, and so is my urologist, that part of that is going to be because of that being on the synthetic testosterone for so long. And I don't think a lot of guys that go into these clinics to get this done, no one's telling them that. And I don't want anybody else to go through what I did. So what are kind of the common things you're seeing and that you look for as a professional in this space that guys should be looking for red flags? And what are the reasons why, even if it's there, maybe they wouldn't want to be on testosterone?
The story that you shared about your personal story is not uncommon these days, but everyone's afraid to talk about it. Because of a long-standing kind of culture, and I'll bring the historic perspective to this, and then also talk about where we're at today. And you're 100% right. And a couple of decades ago, when you watched John Wayne on TV, when you watched the Cowboys, they didn't complain about much, and you just had grit, and you just got through what you had to get through when you were on your adventure in life. And so that part was true about masculinity and how you were supposed to approach life at that point in time. But as time has been changing, and where we're at today, they don't have the same environmental risk factors that we have been predisposed to, where our physiology is different. So the modern man today actually faces a lot of detriments to their health from environmental factors such as BPAs from frying pans, from what they eat, anti-pesticides. You have chemicals and ultra-processed foods. You have seed oils. All of these things that didn't exist when we weren't such a successful nation exists today, which is actually starting to hold back men from achieving their masculinity, achieving their physical health, their optimal health that they're supposed to be at. So we're starting to now catch up to, it's almost a twofold approach of trying to, it's a vulnerability of our actual successes that we're having. Because we're such a successful nation and industrialized nation, we've solved the problem of hunger, but we've done it at the cost of ultra processed foods that's easy to get, convenient, and cheap. But then it's starting to affect our hormone levels, and what that actually has impacts on all aspects of our life. And exactly as you mentioned, so once you're in your above your 30s and 40s, if you compare the average man today at 40 with their testosterone level to what it used to be 20, 30 years ago for an average man 40, we're way below the norms of what it was. So our clinicians are starting to realize this is more of a problem. So just like the great clinician that you went to that said, hey, let's get this tested for you, that's starting to be more part of the conversation. Now, why wasn't this part of the conversation 5 years ago, or let's say 10 years ago? It's because our healthcare system is actually driven, our healthcare decision-making, by health insurance payers. So there's no routine test, routine screening test, like there's a routine colonoscopy, routine LDL levels, routine triglyceride levels, which are supposed to be done for men as they age into their older age, which is above 40. There's certain screening tests. Testosterone isn't on there. So if you have a primary care physician, it's one thing. And if you do have a primary care physician, they frequently won't test for it because it creates a mountain load of paperwork that they have to then file with the insurance company just to get that one test approved. And so most people don't end up getting their testosterone levels tested. And so today is a very different dynamic as far as hormone health than it used to be 20, 30 years ago, which brings to then the next question. Okay, you've gotten diagnosed, somebody screens you, now you have a test, a blood test confirms you have low testosterone levels. Where do you go from there as far as some of the most overlooked signs and symptoms of low testosterone when you get tested is low energy, brain fog, fatigue. So if you're just drinking, having your everyday routine, but all of a sudden it seems that you're missing an extra X in your life from the effort that you used to put in, the ambitions that you have, the motivations. Essentially imagine yourself if you ever did have a peak testosterone phase in your mind, close your eyes and think about, there was a time when I was just aggressive with life, or if I was more ambitious in my life, usually for people, their peak of their life is at the age of 37. These are all averages we're talking about, but from clinical physiology, people are at their peak at their fine motor skills, hand fine motor skills are at their peak when they're 37 of age.
Mhm.
And so think about 20s and 30s, how you felt compared to now, how do you feel today? And that could be one of the biggest signs to say, hey, maybe I should have my testosterone levels tested. They're supposed to decline with age after you peak around your 30s, but sometimes that drop is very drastic compared to everyone else, which is kind of the same thing with high blood pressure, right? Which is the most common chronic illness. Everyone's blood pressure goes up a little bit as they age, but other folks will have a higher pressure in their blood veins. And so they end up taking a antihypertensive medication because they got screened for it, somebody managed it, someone tested it. So just some people's bodies react a little bit more to the environmental factors than other folks do. So those are some folks that I'd highly recommend getting tested. If you're above the age of 40, if you feel that something's off in your life and you quite can't put your finger to it and to exactly describe the symptoms, some of the symptoms you can have is a loss of morning erections. If you've never had a morning erection, or if you're wondering yourself, what does that even mean? Get your testosterone levels checked out. If you're having a decrease in your energy levels, if you feel you're not very focused in life, if you feel that your motivations are low, your ambitions are low, and your body's just not moving how it used to be or recovering how it used to be after workouts, these are all factors that play a role into it. So now you've gotten tested. Let's say you get diagnosed with it, and you get a prescription for testosterone. What are some red flags that you can think about that get often missed or misattributed as far as?
I want to pause for a minute as far as what guys should be looking for, because we know our testosterone is impacted by our social status and how the world engages us, as well as how we engage the world. And so that guy that's depressed, that's super listless, that just doesn't have the energy to move, it's probably like a self-perpetuating cycle at a certain point with the testosterone, isn't it?
Absolutely. Absolutely.
And so if a guy's doing that and what are things that they should be doing before getting on testosterone to see if they can kind of jumpstart things again? Is that a possibility, or once it's down, and you really probably need the bump to go get some help?
There's lifestyle modifications are always the first line for pretty much many medical conditions, and this is one of them. It's hard to pinpoint exactly what caused it, so we never get to the root cause of why someone's testosterone levels are low, but you can start to definitely take actions and starting to treat it. So once you start to, one of the most frequent misconceptions that people have with diagnosis of testosterone is that they think that it only deals with issues in the bedroom, which isn't true. It actually shows up in less obvious ways, like fatigue. They don't feel restful after sleep. Unexplained weight gain is a big one. If all of a sudden they're packing on pounds, or they're especially belly fat or abdominal fat, that's usually a red flag to get your testosterone levels checked. But there's a lot of talk online about boosting testosterone naturally with diet, exercise, and supplements. And these things definitely do matter. Quality sleep, starting to have moderate exercise with weightlifting, stress control, having a high protein, low sugar diet. All of these things definitely help with increasing your testosterone levels and should be the first step. But these only move the needle so far. So depending on how low your testosterone level really is, if you're too far off the curve, then no amount of lifestyle correction will get you the amount of correction that you need. You'll get the marginal improvement that you need.
It's interesting. When I went in the first time and I advocated to get the test, my GP said that I was within the average for my age, not acknowledging that has shifted over the last 20 years to detrimental levels. In your practice, is that still what you're seeing the general medical industry doing, is going off of the testosterone averages of guys today versus our natural state of healthy testosterone?
Yeah, and so the thing is, we used medical evidence is usually 10 years behind from actual state of the art research, and that's 10 years, and that's just how the way medicine's practiced at large, and that's because it takes that much time to do some research, have randomized control trials, multiple level 1A evidence, and then get that published, getting it into textbooks, teaching those next medical students that are then going to graduate in 4 years to actually practice a certain different way. So change, they say some of the slowest industries to change their practices are medicine and in education. Uh, and so the range for testosterone, the normal range is, if you go to most labs that they take, it's between 200 to 1200. So as you can imagine, that's a very broad range there to be considered normal. And it's not age adjusted. That's the biggest problem, because most other tests, we've gotten sophistication to start to say, hey, there's an age associated normal for a certain test, like a cardiac enzyme. But for testosterone, that hasn't been the case. More and more talk is being done about it. But today, you're 100% right. And if you go to any primary care physician to get a testosterone, if it's between the range of 200 to 1200, they'll say testosterone's within the normal range. We can move on.
I can say that when it was down around the 200s, it was not normal. That felt awful. The belly, for me, the weight gain was very clear. The energy level was really clear. And I couldn't recover from just minor hurts as well. Like just bruising and stuff took longer to heal. It was really surreal. I felt all of a sudden very old is how I frame it. I guess with all this, right, the masculinity conversation and having some kind of metric for it has been really important. It's informed a lot of my work I'm doing here on the podcast around how to socialize some of these things. But there's also just a lot of bad actors. So let's say that a guy goes through, they get the test, they advocate, they're like, okay, I need to do some kind of treatment for this. And I know one of the options is actually getting on testosterone itself. I use a medication instead, which works really well for me. And I imagine there are some that you'd talk about with different patients depending on their needs. What should they be watching for? Because I see a lot of really predatory actors in these health clinics.
So testosterone is a substance which is FDA regulated, means that you have to have a prescription for testosterone. So if anybody is selling you testosterone, synthetic testosterone, or any sort of a testosterone supplement, which is not FDA approved or doesn't require a prescription, means those are bad actors. I would definitely stay away, because some of that's it's illegal. And number two, they're getting stuff, and there have been multiple FDA arrests and busts in this territory for people that get stuff from China, and then they sell it on the internet or sell it in gyms, in locker rooms. Someone who knows a guy can get a package.
It feels very akin to what I used to think of as steroid culture.
That's right. So anabolic steroids, some people use testosterone, synthetic testosterone, as a supplement for their goals of anabolic muscle growth, which is one of the benefits of testosterone. But also, that's exactly how they used to talk about anabolic steroids. And so tren is the one that kind of frequently comes up online, or oxandrolone, which is frequently used in the muscle bodybuilding world. We don't recommend those things. And if anybody who starts off with that as their testosterone treatment, I would run, not even walk away. I would run from them.
So if it's going to be within the fitness space, you probably want to do a double or triple take on as to whether they're doing it right. The place I went to ended up being it was a clinic, and it was with a nurse practitioner, but they also seemed very willy-nilly in their prescription. Like, I only needed the small pellet. I would get the pellet treatment, and they put in the larger one on accident, and there wasn't a conversation about that being a bad thing. And it was. Like, it was fundamentally different. All of a sudden I was angry. All of a sudden I had different physiological symptoms that were not comfortable. And that was just from a mistake, because they're like, well, yeah, you got more. Isn't that good? And that was with a medical provider. They should look for, if it's synthetic, if it doesn't have a prescription attached to it, that's going to be a huge red flag. If it's kind of fitness related and gym related, double check these things for sure. What are they looking for? How do they know if it's a reputable source for care and somebody who's taking them through the best options instead of the easiest option?
Well, one thing is the marketing messaging. If somebody is marketing testosterone as a product rather than actually the condition that they're trying to treat, I would take a second look. Meaning, in order to regulate someone's hormones, which is going to impact every facet of your life, you don't want to be injecting yourself with something cheap that they got from China that might be obtained illegally, because you can imagine the type of effects it'll have on your body. The person that you're talking to, or the clinic that you're talking to, one thing is they should be having a real conversation with you about what symptoms you're having, what are your goals, what's your medical history, and how does your lifestyle fit into play. Just from obtaining a history, a part of it. So the way whenever you go to any professional and talk to them about services, the way the questions that they ask, you should be paying attention to what they're asking you. And if they're getting a comprehensive picture, if they ask you one question, check a box and start to prescribe you stuff, likely they haven't done their due diligence, and maybe they're just making money off of giving you prescriptions. And the second thing is checking your testosterone levels. It's a whole picture of within hormone health. There's a various facets to your testosterone health, and some of the most important to pay attention to is it's not just your total testosterone levels. You actually have to pay attention to your free testosterone level, which is the unbound component of testosterone that actually is physiologically the functions of how testosterone is in your body. And then secondly, what are your estradiol levels, your sex hormone binding globulin, and your LH and FSH markers. The LH and FSH, for me as a clinician, I'll tell you as a doctor, that's the one that I pay attention for, because not everyone checks your LH and FSH levels because they don't have to in order to prescribe you testosterone. If your testosterone levels are low, they can prescribe it to you. But any good clinician will first ask you about your LH and FSH levels, because one of the reasons you could have a low, and this is rare, but happens far enough that any endocrinologist that you go to would make sure to ask you this question, is what's your LH and FSH levels? Because if you have a prolactinoma, which is a small tumor in your brain, that could be the reason for your low testosterone. And so that it happens about 1 in 1,000 cases, but any physician would screen you for that and to say, hey, if your testosterone levels are low, could it be a brain tumor? And that's causing your low testosterone levels. And the reason they would ask that before giving you the testosterone is because if you just mask the symptoms by then increasing your testosterone levels, you will never figure it out until it's 20, 30 years later and you can't see out of an eye because where the tumor would be near your hypothalamus pituitary gland.
I love that you're talking about this. I don't want everybody to think you have a tumor because you have low testosterone, right? But right. The overarching point is clear. So many guys that I talk to and refer for hormone treatment and to get it explored, the focus is on the symptoms and not the health. Like I really have to pound on my guys that this is a predictor of your other health issues. You need to incorporate a complete body health with this to make sure that it's what it seems like and that you live the life you want. I think that's a big part of what I saw at the clinic I went to for that one, and what I hear from a lot of guys at some of these, I wouldn't call them shady, but I'd say lazy is probably a better way, just lazy providers, is that, well, my penis is hard again and I'm hitting the gym well again. Good. I don't have to worry about anything else. So we know like the brain tumor is one way that this could go really wrong. I've read that heart problems can be equated to also running your testosterone too high for too long. What are some of the other risks that you really watch for with guys as you help them figure out the right path forward?
Yeah. So one of the things of getting your body ramped up again and functioning on high levels is you start to produce more red blood cells. And, it's a metaphor in life. This guy is full of energy. He has more blood than the other guy, or he has red hot blood,
Mm-hmm.
and it's actually physiological. There's some backing to that. And so once you get your testosterone levels higher, you start to produce more red blood cells. So your organs are more well perfused. There's oxygen carrying capacity is a lot higher in your blood. And so you feel a lot more fresher. You feel a lot more youthful. You feel a lot more energetic just from your organs getting a better perfusion. But when they gets too high, there's a problem, right? So if your red blood cells get too high, it can actually put you at rest for clotting. And so that's something to look out for by getting, and what you're supposed to do is get a blood test, a complete blood count that looks at your hemoglobin levels. And so that's a side effect that is to be monitored. And if it gets above a certain amount, then you start to pay attention to how else do you manage your testosterone and what you should do about the red blood cell count being too high. So it's the full picture and of the side effects and of the detriments that you can have with testosterone that need to be managed. And that's exactly why it's a prescribed medication, because you're looking out for the risks and the benefits and consulting with your medical provider and having that shared decision to say, hey, these are my symptoms. How should we titrate it? And if they give you a bigger pellet more than once, that there's an issue with it. Otherwise, and that's the response to that person said, hey, aren't you happy you're just getting more testosterone? And the answer is no, because you're putting me more at risk for side effects without the actual therapeutic benefit for it.
I think it's also really interesting that they don't have conversation with guys around what their goals for the future are. And I
Yes.
think it's because so many guys going in for testosterone are older, so the assumption isn't that they're worried about fertility. But for laymen, and I was certainly surprised by this when I found it out, you'd assume, knowing nothing else, that if I get higher testosterone, I'm more virile, meaning I can probably produce more children. And in fact, the opposite is true. Can you speak to that?
Yes, absolutely. So this is the biggest thing that's left out from when people prescribe testosterone just online or from a non-reputed clinic or non-clinicians, because you can get testosterone prescriptions from mid-level providers, what we call them, which is nurse practitioners, physician assistants. These clinics are not run by physicians, and there's some the bigger players. Actually, there's some big companies out there that are actually non-physician run that aren't actually even owned by physicians, to be frank. But one of the we touched on the subject a little bit. So when you have synthetic testosterone, one of the biggest side effects of testosterone is that people see testicular shrinkage, and which means decreased sperm production. Your actual sperm count can go down to zero, to the point where there have been clinical studies where they've used testosterone as a birth control for men. So yeah, women's birth control is actually estrogen, take estrogen or progesterone as far as their hormones for birth control. They've even tried doing testosterone therapy to drop males rather than getting a vasectomy, like a surgical approach, just taking testosterone in order to drop their sperm count so much that to use it as birth control for men. So that's the impact that it has on your sperm production. And it goes back to the conversation of LH and FSH. And that's the reason behind it. I can talk clinically about it if you're interested, but it drops your LH and FSH, which is actually in charge of your sperm production.
Well, you're going through acronyms pretty fast, and I don't even know what they mean, and I'm pretty informed for a layman on this.
Yeah.
So let's say that I'm a guy and I'm going to go to my GP,
Mm-hmm.
and I'm going to say, hey, I'm listening to these things. I'm worried about my testosterone levels. I'd really like to get them looked at. And the doctor rolls his eyes, and he's going to have to self-advocate a little bit here.
Mm-hmm.
What should he be asking that's going to cue that doctor that he knows enough that he's actually going to follow through?
If they roll their eyes, I'd say just stop there. Because if your primary care doctor is going to give you a hard time about you being concerned about your health, you probably need another doctor. You shouldn't.
I agree. And
Yeah.
most of the guys I work with, they don't have a lot of options for what doctor they're going to. They're
Yeah.
on the insurance they're on, they get to where they get to, and to get another provider is 6 to 9 months. This is the access of care they have right now. And so if it's that person where, yeah, if they can afford to get a great doctor or concierge medical service, that's fantastic. I love it when my guys can get that. But so many of us barely have access to a GP.
Yeah, and they're stuck. And you're totally right. So our concierge service is exactly tailored for this problem. And one of the things is, one, so you highlighted the big portion, the primary care physician rolls your eyes, you're already feeling vulnerable, you just brought up something, and now they're not taking it seriously, which is only making this 10 times worse for you. And then number two is most of the primary care physicians in the US are actually female. And so you have male patients that have been shown in literature usually wait 4 to 5 years before they actually bring up their concerns about vulnerable conditions such as this. Because one, their primary care physician, their GP, their general practitioner is a woman, so they feel kind of more vulnerable and don't want to bring up something like this. And number two, maybe their wife is also one of their patients or a community member. So they don't want to go to church or their community events and see this person that now knows that you have bedroom issues with you and your spouse, and have to be kind of worried about it. And so there's about 4 to 5 years before men actually even broach the subject with their primary care physicians for all these issues. And that's exactly why we have this discrete private concierge type of approach to get these conditions addressed. But let's say that, okay, you get the courage and finally ask them, and then they say, hey, let's start taking a look at your levels. At that point, one of the things that you can say to them is bring up the fact that the Traverse trial, and that's something I'll drop in the conversation. The Traverse trial is actually changed the whole paradigm on testosterone health, because there used to be a big black box warning on testosterone saying that, hey, this can increase your cardiac risk due to hypertension. And so most people didn't want to talk about the prescribing testosterone. But if you Traverse trial changed the game by FDA because they removed that black box warning, and this just happened last year, 2024. And most physicians won't be up to date about a year from now. But if you say, and so if you say Traverse, spelled out TRAVERSE, the Traverse trial got rid of the black box warning. I'm really interested in the testosterone trial. They'll know that you're not just asking for some anabolic steroids or something that's shady or there's kind of peak, but that you've done your research. You're asking them about some medical evidence, and they'll take you a lot more seriously.
Yeah, I think having that medical evidence in your pocket is amazing too. And that 5 year stigma is just so consistent in my practice and what I see with guys. And it's why I tell my story about my testosterone is I want to get this normalized. It's an epidemic problem right now. Middle-aged men in this country are suffering with this. And some of it, like you said, is that there's female doctors in front of them, and so they think they can't talk about it. I can tell you there are wonderful female doctors that are absolutely informed and will help you if you open the door for them to do so. And if they don't, then yeah, like you said, it's go through the process of whatever that looks like to get to a doctor that you do feel comfortable with, but take your health seriously. There's a urologist that's on YouTube a lot, and I forget her name right now. I'll link her videos because she's great. She talks about penis health and sexual health, but one of the ways that she framed it is your penis's health is the canary in the coal mine for other health problems. Like one of the things I remember her saying was that within 5 years of having ED, a heart attack usually occurs. And so it goes back to that concierge service where you're talking about this being a complete health focus and making sure that the testosterone is one piece of the equation. That's an important one that needs to be addressed, but it's also tied to all the other ways that you're healthy or not and what your goals are. So coming back to those goals, we know that being on testosterone lowers virility. What should a guy that has low testosterone but is still hoping to have children, they can't, if they're not going to get on testosterone, what can they do?
Yeah. Are you talking about Dr. Rena Molick, I think? Is that...
that sounds right.
Yeah. Okay. Yeah. I've seen this. And I love that metaphor that she has. And, I like to say it's the tip of the spear, right? for
there we go.
That you have. And, you're talking to clinicians. So I'm going to get real clinical on you. And so the reason that is because your arteries are the most tiniest when it gets to there. So the other second place where your arteries get really small but supply a very important organ is your heart. And so your penis and your heart are where you have your blood supply coming through the smallest of vasculature that is most pronounced known to someone's health. So if all of a sudden, if you're having erectile dysfunction, you might have either a clotting disorder, you might have atherosclerotic disease, or coronary artery disease. And so, yes, it's showing up as erectile dysfunction, which might be putting you at risk for exactly like you described in 5 years having a heart attack, because your other arteries then are going to start to also show symptoms. But at that time, it's going to be chest pain. So it's going to be a whole different issue. As far as, yes, so the question that you were asking about treatment options for someone who is still trying to maintain their fertility or even to just testicular size, if they're just worried about their not wanting to have a decrease in testicular size volume, or if they're still trying to conceive or would like to conceive within the next 12 months. That's the important part. If you're trying to conceive within the next 12 months, you have to make sure that do not be on unchecked testosterone or as a unitherapy of just testosterone. There's two approaches to it. One is you can supplement it with something that's similar to Enclomiphene or Clomid. Or there's just a couple different options. Short and sweet of it, Enclomiphene, go with Enclomiphene if that's what you're worried about. So that boost your FSH, LH, that's your follicle. They'll break down the initials, your follicular stimulating hormone and your luteinizing hormones. Those are in charge of your sperm production. So what you do is you're taking testosterone, which is decreasing your FSH, LH, but then you're taking a second medication, which is boosting the FSH and LH. So then you have a balanced approach to your increasing your testosterone and making sure that you're still fertile. If you're still a lot more worried and you say, listen, first thing first, I want to have a kid this year within the next 12 months, and I want my testosterone, but I'm not going to sacrifice anything to make sure that I'm able to have a kid this year. Just start off with the Enclomiphene. Don't do the testosterone because you still get that benefit of secondary testosterone increase with just Enclomiphene. And many people choose to start off with that as their first treatment. They go with just Enclomiphene because that will increase your FSH, LH, which will increase your sperm production. So it's actually a treatment for men if they're having any infertility issues, with a secondary benefit of increase in FSH and LH will increase your testosterone production to while it's increasing your sperm production. So many men
Yeah.
actually choose to go with that option, which is a very good option as well.
Well, so essentially it goes back to there are ways to mitigate most problems if you and your provider are paying attention and talking through them. And so like I'm on Clomid now. I don't do testosterone, I do Clomid. And for me, it increased my testosterone to the place I want it to be. And it doesn't feel synthetic. Like when I was on testosterone, I felt different than this. And so me and my doctor, that's what we've chosen for my treatment and going forward. And we keep an eye on things, but that's probably just what I'm going to be on for quite a while. And so it sounds like when people think of low testosterone, they think of it as a singular problem, but it's our health and it's our hormone health. So it's going to be complex. And so anybody you're talking to about it that's treating it like a single point issue is doing you a disservice as a provider.
Absolutely. You wouldn't want to get your tire changed without them checking your fluids, right? I mean, you're doing other, and that's this is your actual health, which impacts you every single day. And so you make sure to check their other things too.
So we've got the fertility issue. We've got some cardiovascular stuff that apparently isn't as much of an issue anymore. What are some of the other kind of things that people should watch for if they get on treatment that'll let them know that their treatment isn't dialed in right?
How your body feels, the symptoms, and precision therapy is exactly that, is getting your symptoms under control. Because you don't want to just treat a number, meaning getting a monthly testosterone test just to see what it does as far as increasing your lab value without you actually feeling different. Mm-hmm. And so if you're not dialed in to correct physiological testosterone levels, you're not going to feel great. So start off there. The symptoms that you started off with in your follow-up visit, if you have one, or just, when you're talking to your concierge physician, texting them, calling them, however, do you feel better? If you're not feeling better, then start to go down the pathway to say, hey, is there something else that's going on that went unaddressed? But this is very exciting for men when they actually start treatment, because they feel the impacts. I mean, you feel it emotionally.
Immediately.
You feel it physically. It's wonderful. I mean, it changes people's lives.
It certainly did mine. It was like waking up from a fog. It was intense. And I think that's part of, I wouldn't be surprised if a provider had talked to me about the fertility issues. I was just so relieved to not be suffering the way I was suffering that I don't know that I'd have heard them in the first place. I feel like we're doing a good job at talking to guys in their 30s and 40s that might be starting to struggle with this, maybe into their 50s and 60s. What are things that you wish 20-something-year-old guys would be doing to protect their health and their testosterone that maybe they don't know to do?
Watch what you eat. In your 20s, you eat anything, right? Chips and a soda.
I feel personally attacked right now.
Convenience is the number one guiding factor for what people put in their bodies. The thing is, you're going to have to undo some of those convenience factors later. Right? Mm-hmm. And so watch what you eat. Ultra processed foods, try to stay away from. Paleolithic diet or whole food diets. I mean, as far close to whole foods that you get, it's a little bit more inconvenient, but you will be more thankful for it for decades down the road.
And I think one of the things that a lot of guys in their 20s don't hear is, I always like the 80-20 rule. You get like 80% of the impact by 20% of the effort in a lot of cases. So what is it, like taking a walk for a half hour a day gives you 60% of what going to the gym an hour does. So even if it's just mitigating how much of the processed food you're having, that can make a positive impact. I'm kind of curious about this one. One of the things I heard is not having your cell phone in your front pocket because of the heat and potentially like the Bluetooth and such. Is that real? Is that a thing?
It's tough to say. It's tough to say because I've heard both sides of the argument. I can't say we've been able to crack the code on it just yet to give hard evidence. And I like to speak from a place of literature and research and practice when I can. But, some of these things, there's no funding to get some of these stuff tested because Big Pharma doesn't want to pay for it, or, the communication services. And so there's no stakeholder that does the studies to figure out if this is a true issue or not. But so jury's still out on that one.
So maybe just keep it in the back pocket because you don't know yet. Could be right.
Or just in the car if you can, 30 minutes a day.
There you go. Hey, get away from your phone, man. It's not gonna do any harm, right? There's diet. You talked a little bit about exercise, right? Keeping moving, keeping healthy. There's the adage if you don't use it, you lose it. So many young guys right now are checking out and not pursuing sexual relationships. I believe the number is 1 in 4 guys from 20 to 30 are not seeking sexual relationships. what's the long-term impact of that kind of celibacy and the movement within the different men's health things advocating for full celibacy where you're not even masturbating? How is that impacting our testosterone and penis health?
There's a way your body's naturally programmed to do things, and going against it is going to cause issues. Being celibate for a long period, so there've been, as far as impacts on testosterone health, there we have a great article on our website which also talks about what does a no fap November do for your testosterone levels, because there used to be a if you watch the old Rocky movies, or if you watch any sports type of movie, they used to talk about, hey, there's a scene where he tells Rocky that he has to stay away from his wife until his fight comes up, so that he's more aggressive in the fight, or his testosterone levels are higher. If that's actually true or not, about what kind of impacts your testosterone levels does it have if you don't masturbate, if you don't ejaculate, if you stay away from your wife. And you'll have to go on a website to take a look at what that a more detailed version of that story, but don't believe everything that you see online on TVs.
I will say that from a mental health standpoint, if it's a religious practice of some kind where there's a purpose and a guidance to self-denial, that's very different than pretending it's for health. And so for all the guys I work with, one of the ways that I kind of check in on their health is how often they masturbate and what's happening with that. It's also really important as a metric to track as to how their relationship is. If they're in an intimate relationship monogamously and their sex life is down, finding out how often they're masturbating also informs how much of a difference there is between the physical intimacy they want to connect with their partner with and their physiological needs. So the way I always encourage it is it's something to pay attention to. And it's something to do in balance, right? If you're a guy and you're in your 30s and you're still like pulling one off 3 times a day, that's probably a problem. That's a little much, right? Maybe don't go that far. But if you're a guy who's like, I'm going to go 6 months and never do this, and there isn't some form of meditation on it, something where you're trying to do something to learn something about yourself, you're probably screwing up. Is that a reasonable statement, man? Am I misleading anybody here?
No, everybody's body's different. But I'll tell you the science on it. The science on it is if you're not having morning erections when you wake up. So, we're not talking about voluntary kind of practices, but just if you're not having erections, well, when you wake up in the morning, that's a physiological sign that your pudendal arteries, which are arteries in your penis, there might be something wrong with it. As we talked about, tip of the spear, canary in the coal mine, that might be an issue. And so with people think that with older age or with certain practices, you can change that. But this is actually a physiological response in your body to waking up. As the lights get clicked on in your body, your arteries dilate and you get morning erection. So if you're not getting morning erections, I would say get your testosterone level checked to take a look at which way you might be headed.
Well, and isn't it the same woman we were talking about, the urologist, had a video on it and said the average for most guys that are healthy is 7 erections through the course of a night of sleep. And that part of that is that your penis is literally cleaning itself and healing itself, because blood flow is how we get oxygen to places. Blood flow is how we heal. And that's the point in which our body is making sure that part of ourselves is being taken care of. Is that accurate to your experience and knowledge?
There's something they used to do back in the day called a postage stamp test. And because nobody can measure, right? No one knows if they're actually having 7 erections throughout the night or anything like that. So a postage stamp test is when you take a roll of postage stamps, and they're stuck together side by side, right? And you put it circumferentially around your penis, and then you wake up in the morning to see if the roll actually expanded, meaning if the postage stamps split up from one another. And that'll be a telltale sign to say, hey, it was a negative postage stamp test or versus a positive postage stamp test. So that's one way that some people can, because people at home are wondering, how the heck am I supposed to know how many erections might be able to sleep?
Yeah, I don't have the weird string attached to the electrode to let me know what's happening here.
Right. To your light switch to see if the light switch gets turned on.
I just want to be on the wall as a fly, listening to the clinician doing that study, talking to young guys about putting something on their penis before they go to sleep. I think that's got to be hilarious. So
I would ask you, what's a postage stamp? Right?
So now right? Now we got a thing. So I love that we're 2 clinicians that talk about this stuff regularly. And right now we're making a little bit of discomfort humor, right? To me, that's what that felt like, of like, oh man, we're publicly talking about something a little taboo. And so I imagine if it's 2 guys that are advocating for men's health having this problem, that stigma is going to be landing on so many of the guys listening. What would you say to the guys that aren't getting this looked at because they're scared to know?
Your health is what's going to empower you. Nobody is responsible for, and that's, health in healthcare. I think this is something I spend quite a bit of my time talking to my patients about. Is nobody owes you anything except yourself. And your health, you have to feel empowered to ask questions the same way as you would as anything else in life. People ask 10 questions before they buy a laptop or a cell phone or a car. What kind of engine does it have? How much horsepower? How many times should I get an oil change? Does this take a premium? Does it take regular? What about your body, right? I mean, this is your actual vehicle that will pay off dividends, what you drive every single day that you run. So asking questions about your body, about how does it work, what certain things supposed to be normal, what's it not supposed to be normal. Before, YouTube and stuff, it was very hard to get this type of knowledge. The only way you could get it was go to your primary care physician. You would only 15 minutes once every 6 months or once a year to get your information. But now everyone has access to this. And ChatGPT, large language models, there's a lot of ways you can start asking questions about your own personal health, so you feel empowered walking into a conversation. I know it's always daunting to go into a car shop and ask something about a car part because you feel like you're going to get scammed or you don't know what you're talking about. But watching videos online to learn about it, asking ChatGPT, looking at Google, and then talking to a clinician will go a long ways to feel emboldened about your health and questioning if something is going the right way, and you're always welcome to a second opinion, the same as you would for anything else in life. If you talk to one physician and you feel that something's not sitting right with you, seek out a second opinion. That's totally okay. Getting a second opinion, which is frequently much appreciated, even to get a second opinion, because something one person could have missed shouldn't impact you for the rest of your life.
Well, especially when it comes to a serious medical issue, it's just a good idea. I mean, at the end of the day, clinicians are people. We make mistakes. We know what we know. And I work a good amount with GPs as clients. And one of the main reasons they're struggling with mental health is because there is too much information for them to track. They literally, I'm working with a 30-year clinician right now who's a fantastic doctor who can't keep up with the flow of information in a way that he feels confident he can catch everything that he's supposed to as a GP. As knowledge expands, it's getting harder and harder for these things to be found. And so getting that second opinion is so important just to make sure that you've got your bases covered.
Exactly. And at 40 Health, sometimes people just send us their lab work to say, hey, can I talk to someone? And that is something that we offer, that we'll talk to you. Our concierge physicians will talk to you, take a look at your lab work. And just if you need a second opinion, even to say, hey, you're fine. You don't need something, or say, did you get additional collateral information, or to help guide your care? Because at the end of the day, one of the things I think people should feel emboldened by is they're not alone. There's a reason why there's epidemic levels of low testosterone. It's because everyone stayed silent. It wasn't because one person did, but a whole generation stayed quiet on it. A whole generation felt that they couldn't talk about it. So when you do talk about it, and your clinician, trust me, has heard many of those conversations probably about testosterone or sexual dysfunction or hormone health or any vulnerable condition, because they're professional and they're supposed to. So feel okay bringing that conversation up and know that you're not alone. You just don't want to fall into one of those statistics at the end of the day and wait 5 years before knowing that you have coronary artery disease or anything else that might be detrimental to your health, and you were just too scared to ask, or feel too vulnerable to ask, or didn't feel that it was masculine enough to ask.
Well, I think this is where women can kind of lead the way a little bit, right? Women for the last forever have had to really advocate against the medical system to get their needs seen, tuned, and met. And a lot of how we've been informed on how to self-advocate comes from what women have had to go through. And for me, what I always think of is that's the cost of patriarchy, right? Their gendered health sucks because for so long it was about keeping men at the top and ignoring women. Now that we're coming around, we're seeing what that's cost us by not having gendered information, by not having test results that are organized by gender and different lab results as just consistent part of the process until very recently. These are where these problems are coming from. And so, like you said, the other thing is fighting that silence. Showing up and talking about it means that the doctor is more likely to ask the next guy about it. It'll remind them that this is an issue. So the other thing is anytime you're addressing a struggle for you within these systems, you're helping all of us. So you step up where you can, guys. It's a big deal. I know it's scary. I don't particularly like telling the world on a podcast that my testosterone was low. And hopefully it helps some of you guys get the testing that you need.
Absolutely. You're not just saving your life, you might be helping to save the next guy's life. And it is that serious. So please do speak up. Please do ask it. And one of my passions, I'll tell you, is birth rates in America, in the United States, are the lowest it's ever been. I mean, this is going to have impacts for centuries down the road. So if doing it for your life isn't good enough, doing it for your neighbor's life isn't good enough, do it for 100 years down the road. Might be the next generation and the next generation after that might be suffering because we didn't speak up when we should have, when it was our turn to.
That's worth thinking about. It's and depressing. So thanks for that. I think it's a real issue. The birth rate thing is something that's on a lot of people's minds. And I think this is a healthy and effective way to have that discussion, is around our health more than blaming women, blaming careerism, whatever else. I think this is something that we can concretely do for ourselves and take leadership in our own health to address. So that's a great point. I want to be respectful of your time, right? I know you got to try to get some rest between these ER shifts and running a business. The next set is literally just to get to know you. And the reason why we collect these stories is to, just like we were talking about, normalizing some of these things for other guys. And so every person that's answered these questions it's been about them. It's been about their experience with their gender, their masculinity. This doesn't need to be about everybody else. It's going to give us a chance to get to know a very effective man who's running a business, who's an ER doc, and what his experience with his masculinity has been. So the first question is, what's a rule about masculinity you learned before you were 12 that's remained true today?
One of the rules that I learned about masculinity when I was young was don't be afraid to ask for help. And a team is actually stronger than a singularity. And I think that's still true today. I think something that one of my favorite athletes says is, if you want to go somewhere fast, go by yourself. But if you want to go somewhere far, go with someone else. And that's very true. With masculinity, when you think about long-term, when you think about achieving your goals, ambitions, what it means to be a man, being successful, don't be afraid to actually go as a team and ask for help, because there are other people that are going to have skill sets which will help you out down the road.
Yeah, I always get very upset at the idea of people achieving things alone. That's just not how humanity works. If nothing else, you drove a car somewhere and someone built a road, man. We don't do anything by ourselves.
That's right.
That's great. And who was kind of instrumental in you learning that?
Oh, my father. I'd say, he's been my role model in life, and has taught me a lot about life. And that's one of his pieces of wisdom.
Oh, man, I'm so glad that you had him. He sounds like he did a good job in a lot of ways.
Oh, I appreciate it. I'm sure he'd appreciate it too.
So the next one is, tell us about a time where pursuing manhood hurt you.
Pursuing manhood where it hurt me was I always felt the need to felt the pressure to have the answers, to be the decision maker, the fixer, the rock for everyone else. But I internalized that idea to say that asking questions or slowing down was a weakness. But it actually led towards slowing of things, less efficiency. Because physically, mentally, and emotionally, when you're chasing a particular version of something, trying to be somebody, it adds an undue pressure on you so you don't move as fast. It's not about just getting to the destination, but you're trying to control the perception of things. But it's okay to not have the answer at a certain time. Wherever you're getting to, whatever you're trying to accomplish in life, realize that it's always just one step in front of the other. And if you don't have the answer to something, say, I don't know. And that's okay. As a professional, as a doctor, you always feel the need to have an answer, especially when patients ask you the very tough question, what's wrong with me, doc? And I'll tell you, a lot of times they say, I don't know, we don't know. But we know what's true right now, which is the certain things that we check, which is what your body's telling us today at this moment. But that doesn't mean that things can't change, aren't going to change, that there are other factors that we didn't consider. And so to say I don't know is something that I came to a reality with, which I'd say changed my perception on how I pursue things.
It's funny. I think almost every provider I've talked to has had some kind of experience with the pressure to have an answer, and that being intrinsically tied to being a man, right? The expertise, the status that we get from being the person in the front with the answer matters. And people can see you fix ignorance. They can't see you fix bluster and ego.
That's right. That's a great way to put it.
So we always like to go out on a high note with this. Tell us about a time when pursuit of your manhood empowered you.
It comes down to exactly the reason for this podcast today and this episode. When I started focusing on optimizing my health and not just what my perception was of true health is what really empowered me. I started taking control of my body, of my outcomes, of my actual long-term planning with my life as it comes to health, energy, mental resilience, leadership. Start trying to say that, hey, I can't just say, hey, it's a certain day of the week, or if it's Sunday, or if it's Friday, that my body's going to feel a certain way, or if I didn't have coffee, I'm going to feel a certain way. But to actually take ownership, to say, this is my health. I'm going to keep it on a certain line, certain bandwidth, and I'm going to pursue my goals with my health, to which it gave me ultimate confidence and empowerment to say, hey, I can change things not only for myself, but also how not let life dictate me, but rather me dictating the way my life is conducted.
So by leaning into your own efficacy and what you can do for yourself, life got better.
Game changer. Game changer.
Well, is there anything else that you want people to know before we let you go for the day?
Make sure you pay attention to what your body's telling you. And if you're worried about it, 40health.com, check it out. Just browsing the website, even just take a look at what we're, if you need some more education on the topic, great blogs, great clinicians on our team, board certified physicians, happy to talk to you. And if anybody wants to shoot me an email after listening to this, happy to answer some questions as well.
Oh man, that's really kind of you. I'll make sure to put that in the show notes so that guys can get those questions to you, because I think it's so important to have an avenue for some of those answers. And it's really wonderful that you're providing that for folks. Thanks so much. And that's our conversation with Dr. Valiuddin. At the beginning of the episode, I asked how you're handling your hormone health. What's changing for you now that you've listened to this episode? Leave it in the comments so we can normalize men changing their minds with new information. I know for me, I'm less worried about where my cell phone goes. As always, we like to fact check here. The one thing that needs a little bit of nuance is the Traverse trials absolutely changed how the FDA regulates these things. But as the good doctor kept reminding us, a complete picture of your health is required for competent care for hormones. Remember, go to a provider that cares about that, not somebody who's going to give you a single blood test and put you on a hormone right away. I'm Tim Winicki. This is American Masculinity. And as always, thank you so much for listening. We'll see you next time when we talk about men and the Me Too movement.